Hi, I'm Salman Gohar with the Fit on the Go blog. I'm here with Dr. Rajeev Pathak and Dr. Prashanthan Sanders. They'll be talking to us about their new clinical trial. So what can you tell us about your trial?
So Legacy is a trial that we presented today, and it's really looking at the long-term outcomes of a strategy of weight management in patients with atrial fibrillation. It has a couple of key factors to it. The first is that there's a dose-related impact on atrial fibrillation. So the more weight that a person loses, especially if they lose more than 10%, there's a greater impact in reducing AF burden and actually true AF. The second point is that we want to try and avoid fluctuation in weight, which unfortunately happens as patients lose weight. When you fluctuate your weight, the impact in terms of the benefit is much less. And the third point that we have is really that doing this in a dedicated clinic where it's a goal-directed weight reduction program not only reduces weight, avoids fluctuation and maintains weight so that patients can have this sort of result in the long term. Key is that almost 50% of people, their AF is no longer a burden to them if they can lose 10% of weight. Okay, so this is an important finding of this study.
What do you see the long-term clinical impact that this trial will have in the future?
So really important, considering we have seen that more than 50% of the patient, once they have lost their weight, will have no more symptoms with atrial fibrillation. That just tells us that this is a therapy which has to be offered to every patient and at least thought about what are their risk factors, and we should try and have an optimal management of these cardiac risk factors before we should consider AF ablation and offer them ablation therapy in these patients.
In your trial, how many patients had recurrence of AFib after ablation?
So, remember this is 50% or 46% of people had no further AF, as determined by periodic 7-day Holter monitoring and symptoms out at 5 years. Okay, so the rest of them do have episodes of atrial fibrillation and certainly go on to have ablative therapy or antiarrhythmic drug therapy to try and control that. Okay, but 46% after 5 years is quite a dramatic finding with no rhythm control strategy.
Thank you so much for your time for this interview.